Emma.
Hello.
Hello. So if you can tell me a bit about what your charity does first.
Okay, so what Brook does, we're the biggest young person sexual health charity in the UK. We have different aspects of the charity. We have clinics which are open to young people. They're quite easily accessible. Our clinic in Bedford, we're open 6 days a week. So if young people can't get out after school or if they work, they can come and see us on a Saturday or evening clinics. Or we do have other clinics in different areas as well, so young people don't have to travel all the way over to Bedford. And we also do school clinics as well. So we offer contraception, sexual health testing and treating, pregnancy testing. We offer one-on-one advice, and we offer free condoms as well. And we do obviously forward referrals for TOPs.
What's a TOP?
Oh, sorry, termination of pregnancy. And also as well, what we have is the educational side as well. So that's where I'm from. So we go into schools, colleges, any education provisions, and we talk about sex, and we're very sex positive.
What do you say to people who feel that giving young people all that information is bad?
Okay, well, obviously some people don't like talking about sex. However, we're all here as a result of unprotected sex and sex. And parents don't like us talking about it. However, when a young person learns to drive, do you just give them the car keys and tell them to go off? Or do you educate them and teach them how to drive safely? That's the question out there. You teach them to drive. Yeah, sorry. You teach them to drive safely. Whereas I think with relationships and sex, you have to teach them how to have a healthy, happy, sex-positive relationship.
You also do education on relationships as well. It's not purely based on just sex, is it?
Oh, it's not just sex, no.
Yeah.
We do
that's what it's all about, isn't it, really? Having a healthy relationship that you can express sexually.
Yeah, definitely. And it's about consent and having the young people actually understand about what consent is and how to give consent, and the fact that it's actually okay to say no and to wait until you're ready to have sex.
I mean, I think the work that you do is really great because...
Thank you.
Because there's loads of people out there. I mean, I'm an adult. I've got two pre-teens, and I have this issue to deal with, how to talk to my children about sex. But it's great there's an organisation out there that's willing to talk to them as well and just say it how it is. I mean,
definitely. And
because it's just breaking down that kind of mummy and son and daughter barrier. You're just talking to them, and... the thing about it, as you said earlier, about going in the car and driving, we wouldn't do that. And relationships and sex are so important as part of an adult life that you do need guidance, don't you, to do it successfully. You can't just walk out the street one day when you've turned 18 and you've got it spot on.
Yeah, definitely. And we're always learning. Until the day we die, we're always learning. But it's about making sure that young people have a positive sexual experience, because if somebody has sex before they're ready, they're likely to have a negative sexual experience, which could actually affect them for the rest of their lives. And it is good that if they come to Brook and talk to one of our advisors, it is going to be a non-judgmental talk. Everything's going to be confidential, and we're not going to judge them for what they say. We're not going to go, oh dear, you did what at the weekend? And then go and put it on Facebook. Everything's going to be completely confidential, so they know that they can talk to a professional in a safe environment.
And get 100% accurate information. That's the thing about sex and young people. There's a lot of non-truths.
A lot of this.
And some children or young adults learn about sex incorrectly.
Oh, definitely, 100%.
And that contributes to some of the problems that we have today, lack of education.
Yeah, and I think with the education as well, it should be more of a holistic approach. So it should be charities like us going out and educating, but also the schools should be educating and the parents at home. And I do feel that some parents, because they're not aware, they don't have all the knowledge themselves, they put their heads in the sands and try and pretend that it's not happening and their children aren't going to have sex. But I think it's better to prepare the young people for sex for when it happens, rather than be more preventative, rather than panicking because it's happened and there might be an unplanned pregnancy because the young person thought that it couldn't happen the first time you have sex due to the myths that they've learned. So I think if everyone approaches it positively and everyone sort of does their bit rather than relying on other people to do it and assuming other people are doing it correctly, then we can ensure that young people have a happy, healthy, positive life.
I think that's brilliant. I really do.
Thank you.
It's just crushing those myths. It's crushing those kind of stereotype images that actually suppress the truth.
Yeah.
Because there's a lot of comments out there that people shouldn't be told about. Young people shouldn't be told about sex. And the reality is they just do it not knowing what they're doing.
Yeah, and some people...
So I think someone like you, doing the job that you do, explain it factually, but also explain it in relation to a relationship is what young people need. So that when they go out in the world and they're adults, they can conduct themselves in a healthy way that they will enjoy, and they can have healthy relationships. And some of the problems we have will be eliminated.
Yeah, definitely. And it also, if they're having a positive sexual experience, again, it can help their self-esteem, self-worth. So again, that can be good for the mental health. If somebody is having a negative sexual experiences, or they're in a negative relationship, that can then affect their confidence, their self-esteem, their self-worth, which then can lead to drug taking, drinking. Not saying that happens in all instances, but it can happen, and it can be young people make the wrong choices because they haven't been educated, and then that could lead them into a very dark place.
Very good.
Thank you.
How has casual sex changed in the past 10 years?
I think casual sex has always been there. However, we haven't sort of spoken about it as much, and now people are a lot more open, but also people are more easily accessible because of all the dating apps and that are around. People can get in contact with people a lot quicker, so they're meeting up with people they probably wouldn't have met up with before just by using their phone. Which, by that, there's been a massive increase in the STI rates, sexually transmitted infection rates. So we're seeing a massive increase on them.
I suppose as well the fact that we have advanced medically as well makes some people complacent. Do you think that's
yeah, and I think as well it does make people complacent. They think, oh, never mind, it doesn't matter because I can just take a couple of pills and it will get rid of it. Well, if you get an STI, you don't know what one you're going to get, and unfortunately, if you do have unprotected sex, you could contract a STI that you can't actually get rid of.
How do you think this has affected people's sexual health?
I think with regards to sort of sexual health and how it's affected people, there is still a lot of stigma around sexual health. People are very much like, oh, I can't go and get tested because people are going to think that I'm dirty, I sleep around with a lot of people. When actually it's not. Anybody that has sex can actually contract a HIV. Okay, so anybody that has sex can actually catch a STI. It doesn't matter what age you are, who you've had sex with, how many people you've had sex with, what your religion is, where you went to school. If you're having unprotected sex, you're actually putting yourself at risk of catching an STI.
Who is affected by STIs?
Who's affected by STIs? Absolutely anybody. Anybody that is having sex without the use of a barrier method of contraception, which is a condom or a femidom, is actually at risk of contracting an STI.
Do you see more males or females as clients?
Actually, we see more females through the clinic, which is a bit of a shame. We don't see as many men as we would actually like, even though I think sometimes people think that it's more of a woman's responsibility, and because we do contraception, they just sort of possibly, I'm just assuming here, possibly put out that, oh, it's just for women, when actually we are for men as well. And men should come through the doors, and men should take responsibility for their sexual health. If men that come through the door, they just want condoms, they don't have to sit and wait. They might have to wait for a bit, but they can actually register for a C card, which is a condom card, which gives them access to free condoms, because condoms are actually quite expensive if you're buying them in the supermarket, and if you can get them for free and it only takes half an hour, 20 minutes, I would do that. so much easier.
How easy is it to catch an STI?
It can be very easy. Again, it's like playing Russian roulette. You might not catch it the first time you have sex, or the second time. It might be the fifth time you have sex, or it could be the first time you have sex. So it is really important that you do protect yourself against catching an STI, or if you're with a partner and you decide that you don't want to use a barrier method of contraception, it's about thinking, okay, we're having sex, let's both go to the clinic, get a full screening, so we both know that we haven't got anything or any STI to pass on to each other, and then think about a different form of contraception.
What are the symptoms?
Oh, the symptoms of STIs. Well, majority of them, actually, there are no symptoms at all. So, 1 in 10 sexually active young people between the ages of 15 and 25 actually have chlamydia and don't actually know that they've got it. And they could be passing it on to other people. So it is really, really important. If you've had unprotected sex, come down the clinic. Everything's free of charge. It's completely confidential. As I said before, we're not going to put a shout out on Facebook or any social media sites to say, guess who's been in the clinic for a check. Say it's really, really easy to test for, so it's well worth coming in. The staff are absolutely lovely and friendly. However, saying that, if you do have symptoms, it can be pain when urinating, so it's like a stinging, burning feeling when you go for a wee. You could have a discharge, so a discharge, women get discharged naturally, so it's something that's different for them. And for men, when they have a discharge, that's not natural. So discharge, it isn't like ejaculating or going for a wee, it's like you've got discharge. Okay, so other symptoms could be lower abdominal pain, pain when urinating. For women, irregular bleeding, pain after sex. Men could also have swollen testicles as well. But as I'd just really like to emphasise that a lot of people do not have symptoms at all. And as I said, it's really, really easy to get tested for. There's a lot of myths as well about testing, why men don't usually go, is because they think they're going to have an umbrella put down the end of their penis and dragged out and that it's really painful. We don't do that. So that's just a myth. What we do is urine tests. So the men that come to our clinic just have to pee in a pot, and then that goes off and gets tested, and then they make sure they get access to free condoms and a health professional. With women, they do have the choice of either a urine sample or a swab, and it's as simple as that. It takes a couple of minutes and it's over. No pain. And in the samples and everything as well, you actually do yourself, so you don't have to worry about not exposing yourself, but having to get undressed and stuff in front of anybody. Okay, and also another way of testing for HIV and syphilis is a simple blood test that can be taken, just taken from the arm, and that gets sent off. All results come back within 7 to 10 days, and all results are completely confidential as well. And I'd just like to say as well that testing is free of charge as well. You will not have to pay for anything.
There is definitely no excuse then, is there really, not to be tested, especially if you have concerns?
Yeah, definitely not. And we do recommend as well, if you're in a relationship, that you get tested on a yearly basis. People give their cars an MOT. Just go and get yourself MOT'd, get your genitals MOT'd, just to make sure that you're safe and you're healthy. Or if not, if you do change partners, we recommend that you get tested every time you change a partner as well.
And how would they contact Brook if they wanted some support and advice?
Okay, we're really lucky for Brook and the young people because we actually have drop-in clinics. So no appointments necessary. You can actually just turn up and see either a nurse or a doctor. If it is something more specific, you can give us a call and you can actually make an appointment. Our telephone number is 01234 761 090. We are open six days a week at various times. Okay, we do have a Facebook page, which is THT and Brook Beds. If you go on and like our Facebook page, we do have all our clinic information on there. And also you can send us a question as well, private message us and we can get back to you. Also, there is a website, which is www.safesexinbeds.co.uk, and you can get a lot of information on there as well if need be.
I did look at the web page before interviewing. There was loads of information on there.
Yeah, there's lots on there.
So.
And it's all factual information as well. So there's no myths or lies. Everything on there is up to date and factual.
Which is really good. So even if a parent was, say, for instance, uncomfortable talking to a child, they could possibly
direct them
there, couldn't they?
Yeah, and we also say as well is don't Google any symptoms that you might have, because there's lots and lots of websites out there that could give you misinformation. Come over to the Brook website, come and speak to us, because you'll know that you'll be getting up-to-date factual information.
Thank you very much for coming into the studio with loads of information and talking about what both your charities actually do. Thanks very much.
Thank you.
Thank you.